What's going on, everyone? Sydney Gordon here with the Sydney Gordon podcast, powered by Core Medical Group. And today we have Jill Horne, who is our nurse practitioner at our facility in the East Coast Mecca, Bev Francis's gym in New York. Jill, thanks for coming on today.
Great. Thank you so much for having me.
So, Jill, we like to start this podcast off in a little bit of information about like where you grew up, your background, and then kind of leading into how you became and decided to be an NP. I know we have a lot more to talk about with you. You have a great array of angles on the overlook of hormones and health in wellness because you are a competitive bodybuilder, and which is super cool. But we'll get into that as well. But first, can you start about like your background growing up and giving us a little background on yourself?
Yeah, so growing up, I actually come from a military family myself. My dad, my siblings, everybody was in a military family. So I grew up in a pretty strict household for the most part. Went to school to become an RN. I went to Malloy College, and then from there, I went and got my master's degree and became a nurse practitioner. I've always had a passion for helping others and just overall wellness. So I really just wanted to take it to another level and really just offer my expertise to those in need. I have a background in cardiology and internal medicine. And being that I have that background and, a passion for fitness as well, I like to blend my medical expertise with just overall wellness practices.
So you said military background, family. You know that must be helpful when you're speaking to our patients out there. The majority of our telehealth patients now, it's about a 70-30 ratio of active duty veterans. Does that really help kind of understand where they're coming from growing up in that household or
Absolutely, absolutely. So I feel like my unique perspective as a nurse practitioner just enables me to provide that comprehensive care, just not only addressing the medical conditions, but also addressing like the mental and emotional health and their overall well-being. Just being having come from a military background, military family, just dealing with the complex traumas and everything, it all kind of goes hand in hand with hormone replacement therapy and essentially how I like to treat my patients.
so talk to me about the like consistency that you see in that community. I have I see similar things happening over and over again in the community and not being fixed on a VA level. But you as a practitioner, what type of consistent symptoms are you seeing? What type of consistent concerns are you seeing, and what type of benefits are you seeing from core medical supporting these veterans and active duty service members?
So, consistency in regards to the symptoms that a lot of my patients are experiencing, a lot of them are, they have complex trauma, they have PTSD, they have TBI. So, we're dealing with a lot of mental health issues like anxiety, depression, PTSD. We're also dealing with the brain fog from having a TBI. So, or like just the lag or the slow thought processes. And overall, just being in the military, being on active duty, being deployed, we're dealing with patients who were just physically exhausted, have just kind of like their body has just been through the ringer. And, we end up checking their blood work and testosterone levels tend to be on the lower side, or there's some sort of hormonal imbalance where we can treat them and it can help with a lot of their symptoms.
with with you saying the consistency of that brain fog, that's interesting to me because what people don't understand is that like we're actually coming off of a period of time where we had a lot of people deployed in a lot of different places for a long period of time, and now all those people, the majority of those people, although we do have people deployed right now, whether people know it or not, um, have now kind of been brought back to the United States in the masses. And now you have all these people that were active duty coming back to the United States in this big huge bunch being thrown back into the civilian world. And it is the reverse effect of being deployed the first time. When you get deployed the first time, not that I know this, I just know this because my best friends have been deployed multiple times. It's like, oh shit, what am I getting myself into? And then you might have some fear, you might have some the question of the unknown when you're leaving the United States to go be deployed. And then it's the reverse effect coming back to the States. Oh my God, what am I going to be going back into? How am I going to feel, being around civilians again? I've been used to just this one community, not this diversification. And those micro traumas of concern cause major long-term trauma, which people don't really understand. And as we both know, being in burn pits, seeing your friends get killed or shot, seeing civilians being injured, just being in those percussions, and then even the transition from active duty service back to the civilian world, all that stuff adds up, and just puts a beating on that person's body. For me, the hardest part is that brain fog, because that all those things adding up really do suppress the ability for your brain to function like it normally does. I know what happens to me when I have a lot going on in my life. My brain's like mind overload. I mean, I can't even imagine that. Explain to me why all those processes and all those little things add up to suppression in testosterone or suppression in overall hormones.
Um, every there's so many different components here. Of course, like you mentioned, like the different micro traumas, there it does lead back to some sort of chemical imbalance in the brain. So there is that medical portion of it. But just the multiple, just repeated traumas, whether it's physically, emotionally, mentally, can cause a decreased production of hormones. So that can cause lower than normal testosterone levels. It's not necessarily even just the physical part. It's exactly like you said, just seeing somebody's best friend getting killed, or just the shock alone, as like you mentioned, of coming back home to like, what is my normalcy? What is this? Like, it's just like a shock to the body. And exactly like you said, when anybody's brain is kind of just overloaded with information, it just shuts down. And, ultimately everything comes from our brain. Our hormones are secreted in our glands in our brain. And when our brain just can't seem to function the way it used to, it shuts down production of our hormones as well, or it decreases production of hormones.
So, when you speak to a patient that has gone and visited the VA and like explain these concerns to the VA, and then they get to us after, what's like a commonality that you're seeing there? Are you seeing the VA treat these patients properly for hormone deficiency? Are you seeing a lot of SSRIs being provided to these patients? What are there concerns there? Or do you think that they're treating properly for hormone deficiency? Because I know you get to see that quite often.
So, for starters, patients seeking alternative medicine often do so just because they're dissatisfied with conventional treatments, or just a desire for a more holistic approach. And that's pretty much what we offer here at Core, is we kind of treat a little bit of everything. A lot of the patients, unfortunately, going to the VA, number one, it's very difficult to get an appointment. And that's nothing new with the VA. That's been many, many, many years. Even before I was doing this side of medicine, the VA has just been very difficult to work with. When you do see them, they are not really willing to treat hormonal imbalance. The only time they treat low testosterone, let's say, is if it's actually outside the range. So normal testosterone is anywhere between about 200 to 1,000, and they won't even treat for somebody who has like 200. They will only treat if it's below 200. And a lot of times they're only treating to bring them up to 200, and then they take them off the protocol. And that's just not the suitable treatment, unfortunately. And then as well as the psychological aspect, the mental health disorders, VA, they definitely prescribe some of the heftier medications.
I like how you
So
said that.
I
The
I
heftier
yeah,
medications. Like these are medications that you'd really just want to take on a daily basis. Basically, is what you're
they
saying.
are, like, with my background being in internal medicine and cardiology, I've treated a lot of patients for anxiety and depression, and there are so many lighter medications that they can start these patients on, and they start them on, like, the heaviest ones. So these poor guys come in and they're like, I can't, like, I feel like a log. I feel like I'm just blah all the time, and it's these medications. And a lot of times we can treat their hormonal imbalance, which would regulate their mood. Now, sometimes we do need some sort of prescription medication as well, of course, chemical imbalance, PTSD, all of these other issues that do need to be treated. However, sometimes just with the basic hormonal imbalance, we can treat somebody's anxiety. We can lessen their anxiety. Just being a competitive bodybuilder myself, I have experienced the hormonal imbalance because we drop weight really quickly. We gain weight and lose weight like very quickly, and it will definitely like just tank your hormones to the point where you're feeling very anxious and you're feeling very just I don't even know why I'm feeling this way, and it's just really like it's really like scary to be honest with you. So once those hormone levels kind of just go back to normal and we fix them, those levels of anxiety or depression or whatever else they may be experiencing do tend to go back to normal. So there's just a lot of alternative measures that we can take prior to starting these heavy duty medications.
I was having a conversation with a doctor the other day. I obviously we all know that Sidney Gordon's not a physician, but I have a lot of friends that are doctors, and this doctor is very versed, very versed in hormones. Also understands the mental health aspect of what happens with veterans and non-veterans and general practitioners and VAs and all sorts of things like that. And I said to him, I said, "Hey doc, what do you think if you had 100 people come through the door that were experiencing depression or anxiety, and instead of treating them with all these, I would think the word that uses was harder drugs or aggressive drugs. We gave them all testosterone. We gave 100 people, you know, Klonopins and Xanax and Adderall, and then we gave the other 100 people just basic testosterone that were on the low end of range. What do you think the result would be there?" And I'm going to throw that question to you. Like, it seems to me like that would be a great first approach for someone who, if their hormones are deficient, right? If their hormones are super deficient, instead of giving them drugs to increase the to decrease the efficiency of their testosterone, as we know, like those drugs will suppress your testosterone. Some of those drugs will suppress your testosterone. Jillian, don't you think it would be better to give them things to increase their hormones, to get their hormones dialed in prior to giving them these psych drugs?
100%. I'm a little bit more holistic with my approach when it comes to medicine, just period. I've always been that way. I think partially because of my back of just being passionate in fitness and health and wellness. And there's so many alternative measures that we can take prior to starting on these medications, because you're absolutely correct. These medications will suppress hormone production. A lot of major side effects with these medications are decreased libido, ED, and who wants to deal with that? Weight gain, all of these other issues that nobody, I'm already feeling sad and depressed and anxious. I don't want to feel any worse. So there's so many different measures. Treating and hormonal imbalance is for starters. There's therapy. There is just an active lifestyle, implementing lifestyle and dietary modifications. There are a number of different things that we can certainly do prior to starting on some sort of medication.
Yeah, so I mean the flip side of that too, which a lot of people aren't thinking about, is if you're walking the VA for the first time, right, and you're going to commit to, I don't know how they prescribe Xanax, maybe 3 milligrams, 1 milligram, whatever it is. You're going to commit to Xanax, and you're going to commit to a Percocet because your back hurts, and you're going to commit to an Adderall to wake up in the morning, and then maybe a Valium to fall asleep at night, or whatever that other drug is. Which is common, Jill, right? Like you've seen patients prescribed all of these things multiple times, I'm sure, because it's a pretty common theme from what I've seen at Core. I believe too that we're in the pre-stages of starting a major epidemic, because a lot of these drugs you just don't stop. It's really hard just to quit 3 milligrams of Xanax a day. I mean, you can die from that. And the reason why I say things like this is because, guys, we're all in control of our own health. We're not forced to use any doctor in the world, even though the VA might be free for you. It might not be freeing in life. that might not be the best direction to go. So if the VA isn't telling you what you need and your testosterone is below 400 and they're telling you you're in range, you might really want to take some other measures prior to hopping on 4 or 5 different, 6, 10 different medications that they offer. Now, don't get me wrong. I've seen a lot of amazing VA doctors help a lot of people, get out of a hard crunch. But if you're experiencing, depression, erectile dysfunction, you can't play with your kids, you have visceral fat, you can't build muscle any longer, you can't sleep, those things right there are more hormone driven than pretty much anything else. Because I know civilians that experience those 6 major symptoms, we give them a little bit of testosterone and they turn into a superhero, right? So I just wanted to kind of start this podcast out with that direction, because a lot of the people that we do see are vets. But Jill, let's get into the civilian side of things here. What types of things you see going on now in our country that are just overall making things harder for people to stay in shape? What type of concerns are you hearing from our patients, and what kinds of answers are you giving to those things? Are you telling people what to watch out for more than ever? Are you giving them your kind of tricks to the trade? Because I mean, you're in amazing shape. I never ask a woman how old they are, but you've done a great job by staying super fit through your entire life and probably helping a lot of people through your knowledge. So for the civilian side of things, what are you seeing in the United States now that is causing an epidemic of people just not being in shape? Lower testosterone than ever on an average. When I started in this industry, you'd never see tests below this 15 years ago. 35 years old, maybe a 400. Now we're seeing, and we were like a borderline, no one under 30 can get testosterone. Now we have people like 26, 27 with like a 250 test level that have never abused testosterone in their life. Let's talk about that.
So I 100% agree. I am definitely seeing a lot more younger males who have lower testosterone levels. Same thing, never abused anything, never used any black market drugs in the past. And I think just with the rising prevalence of obesity, diabetes, cardiovascular conditions, high blood pressure, hypertension, um, everything is essentially like healthcare is unfortunately is kind of getting a little bit more difficult for people. I think it's just everyone is getting busier, people are working more, and they don't have the accessibility to or the availability to cook a home cooked meal. So we're eating out a little bit more. We are just kind of snacking, eating wherever we can. That's a huge trend that I've seen with a lot of my patients. Because here we're not just looking at hormones when we look at blood work, we're addressing everything. A lot of these patients don't necessarily have a primary care. So we're looking at their diabetes numbers. We're looking at cholesterol. I'm addressing high blood pressure. I've even gone as deep into dealing with more cardiovascular conditions just because I have that background. And a lot of it is just promoting preventative care measures, having an active lifestyle, participating in physical fitness, just being conscious of weight management. A lot of it is discussing like over-the-counter supplements and things of that nature. However, I just feel like the world is just getting like tougher to live in essentially financially for a lot of people, and so people are now working more and people are working from home more, so they're ordering food. Everything is accessible. Junk food is accessible. We have DoorDash, Uber Eats. We have so many different where people are just click of a button and we're ordering things. People are not going out, they're not walking, they're not active, they are just kind of just hanging out at home, working from home, and rinse and repeat. So that's increasing the prevalence of all of these conditions, and let alone a lower than normal testosterone level.
You just pointed something out to me that I just like, I had this mental image of like this like cartoon of this like just guy that starts off like in shape, and then COVID hits and he's ends up, the company decides, all right, guess what? We just get to shave all this overhead down off. So now you get to stay home and work. And this guy who's in shape now just gets more and more and more out of shape just because of all of the things accessible now that they wouldn't even think of in the office. When a lot of my staff, I if you're seeing this, our staff is all in shape. We have no one that is representing core that is not in shape. We all train together. We have black belts in jiu-jitsu, kickboxers, pro hockey players. Everybody is very continuously training. A lot of my staff brings food to work every single day. Cooks from home. The way I grew up was my mother cooked every single night at the house. If we went out to eat, it was like very, very seldom. We went to farmers market. She grew freaking stuff in the background, in the backyard. We were just, it was just a different lifestyle. Now I just, the point that you just made about like Uber Eats and stuff, it's like, yeah, unfortunately you look at Uber Eats and you have just this menu of like stuff that you can just click on that just is bad for you or good for you. And the brain is just going to say, oh, you know what? I'm just going to cheat today. Oh, I'm just going to cheat today. Oh, I'm just going to cheat today. Rather than like planning out and prepping your food and giving yourself that cheat day. I never heard it. I never hear anybody talk about a cheat day anymore, Jill. All I hear is people just cheating. So it's like the thing over the last 3 years, especially, I can definitely tell you there's been a huge downfall or a massive increase in obesity from the ability to work from home. And until you said what you just said, I've never even thought about that.
Yes, definitely. It's definitely the accessibility working from home. Just, people are busy, they're working too much and they're grabbing on the go. It all comes back down to diet at the end of the day, just overall feeling of wellness. It's what you put in your body. You got to feed your body right. You got to treat your body right.
Is so we get a lot of patients that say, oh, I want to start working out before I get onto testosterone. I hear that quite a bit. And or they might ask you, do I need to be in the gym prior to starting testosterone? So my answer is, well, when was the last time you trained? And they're like, well, 5 years ago, 3 years ago, 6 months ago. Well, why aren't you training? Well, I just don't have the mental push. I don't have the drive any longer. And I'm like, well, then I would highly suggest getting on testosterone because it's probably going to give you that drive to start working out. What type of suggestions do you have for people that give you that remark?
I always recommend starting out with testosterone replacement, being that there is a hormonal imbalance. So that's why you are feeling that fatigue and that lack of motivation to get in the gym. Not only that, that's what's causing you to gain weight in that midsection area. It's more difficult to build muscle. So ultimately, we can certainly get in the gym and that would be great, but we have to fix the underlying issue, which is the hormonal imbalance. For those who haven't worked out in X amount of years, 5 years, or a prolonged period of time, again, it's just recommending let's start on this regimen. And while we start on this regimen, let's start to implement our dietary and lifestyle modifications so that everything can work in conjunction with each other.
Yeah. So basically, I have this rule. It's like so where people are getting on to HRT, and there was a stigma behind this before, right? It's like, and Jill just nailed it on the head. There's a stigma behind it before. It's like, oh, I don't want to take steroids. Well, I don't want you to take steroids either. These are hormones that your body already produces. You can't find like equipoise or tren or Anavar or Winstrol in a blood test, but you can find testosterone in a blood test, and we're just filling that void for you, right? So when you are feeling down and you feel like, oh my gosh, I can't go to the gym, I have no energy, and your hormones are deficient, just like Jill said, and we fill that void for you, now all of a sudden you have the ability to have energy, get up and go for a brisk walk, play with your children. Maybe your erectile dysfunction starts to go away. These are some of the things that you're going to see even without working out. So we're not giving you testosterone to get bigger in the gym. This testosterone is providing you a better lifestyle and a healthier lifestyle. So the big thing here is there's a lot of patients out there that are looking at this like, oh my God, I'm going to take this just to get bigger in the gym. That's not our goal here at Core. And our goal here at Core is to give you a better lifestyle and have a healthier lifestyle. What type of stigmas are you hearing when you speak to patients? What type of concerns? What are things that you'd like to overcome on this conversation for patients to understand, to not be concerned about, to not be worried about? We're not giving you astronomical doses of testosterone. We're giving you a minor dose of testosterone. I know when I was 215 pounds, I was taking 600 milligrams of test a week. It's just not a good look for me. I look like the Stay Puft Marshmallow Man, and I was like pink. I didn't know what an estrogen blocker was. My testicles were like that big. And now, obviously I don't really look like I'm on testosterone. I just look like I stay in shape. So why don't you talk to us a little bit about someone's concerns coming through the door at Core, what you hear a lot of, and what you would suggest not to be worried about?
So that is probably like the number one concern that I always hear, is that everyone's concerned that this is some sort of black market testosterone, or they're going to become very big, or they're going to have like roid rage, or they're going to be irritable and red and swollen. I always reassure my patients that we only prescribe like legal doses, being that we are healthcare providers. We can only prescribe legal doses of testosterone. You're not going to be like the Incredible Hulk, like lifting and slamming things down in the gym. It's just essentially going to get you back to some sort of baseline and some sort of normalcy so that you're able to operate in your daily life. So you don't need that afternoon nap anymore, so that you can build a little bit more muscle, a little bit easier, and we can fix those decreased libido or ED issues that we have. So that is generally the number one concern. We do have some, especially my younger population, who are concerned about preserving fertility as well. That's always a topic of discussion when it comes to testosterone. So testosterone does cause suppression of those sex hormones, the ones that are responsible for fertility. It's not something that's irreversible. Most of my guys who are looking to conceive, they just either come off their protocol. I've even seen it where we've just dropped down on the dose and they were still able to conceive. We have other supportive therapy medications that work to preserve fertility. So ultimately, we have a number of different protocols and different ways that we can treat low testosterone, without causing any lack of fertility or causing you to be overly large or having any of those other symptoms like the irritability, water retention. We have a lot of supportive medications to treat everything here.
Yeah, I can tell you from experience that testosterone, it depends on the severity of your, it depends on your original ability, in my opinion, to be able to have kids in the first place, right? And then in some situations, it could be our significant other, right? But for me, I had two children while I was on testosterone. Actually, three. We had a miscarriage, and I never even changed my dose. But what we see quite a bit of, like Jill was saying, is for instance, if you're on 200 milligrams of testosterone per week, and you're maybe on like enclomiphene at the time or something along those lines, we would simply, lower your dose to 100 milligrams a week and give you HCG at the same time, and with some clomiphene or enclomiphene, and that would spike the ability for you to conceive. And we have patients on a weekly basis call and tell us, my gosh, thank God I didn't have to come off of this stuff because my other doctor had me do it before, and blah, 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 blah. Even Nick Kay tells a story of him coming off testosterone for it's like 7 months, and just the weight gain and the misery and the anger to have a child. Because what people really don't understand is that they're worried about like having like roid rage when they come on testosterone. Well, come off testosterone and you're just like angry at the world because you just feel like shit and you're in depression, when unless you're coming off on a strong, a good protocol. There's a lot of HRT clinics out there that don't even give you things to support your natural production, LH and FSH. So when you come off, you just crash. And I've felt that before. Jill, I'm sure might have maybe felt things similar to that from, being a competitive bodybuilder. It just doesn't happen for a man; it happens for a female as well. There's a lot of things that go on inside the human body, as she said, when you're competing, or even when you're changing your hormone levels. Our goal is to keep you consistent and keep you on your protocol as the NPPA or MD prescribes. So, Jill, can you talk about just really how important the consistency of it is to take the medication? Because we run into quite a bit people being like, oh yeah, I have plenty of these little white pills left. I don't feel anything from them when I take them. So like that consistency of which I know that you are probably a very good person to talk about consistency, because your life has to be very staged. Everything has to be pretty much perfect to do that, to be in the sport that you're in. Everything has to, you have to be on schedule. And talk to us a little bit about how important, staying on point with the medication is.
Yeah, so staying on top of our testosterone for starters, of course, we want to make sure that we're taking it regularly, because we just don't want those symptoms to come back. You don't want to feel fatigued, you don't want decreased libido, and all of those symptoms that brought you into us essentially to come back. But with that, we do have our supportive therapy. So we have anastrozole, which is our estrogen blocker. Although you don't feel a difference taking the medication, when we look at your blood work, we are checking for your estrogen levels. High estrogen levels can lead to mood swings, irritability, decreased libido, fatigue, acne, water retention, all those roid rage symptoms, essentially. And so testosterone and estrogen have a direct relationship. So once we're increasing your testosterone, your estrogen levels are increasing as well. So although the patients may not feel a difference when taking the medication, it's very, very important to continue to take the medication. And then with the enclomiphene or the HCG, gonadorelin, whichever one, the other supportive therapy medication, that's going to stimulate our natural production of testosterone. So again, although we're not feeling a difference, that's supposed to keep our production going. So we want to make sure we're preserving our fertility, those sex hormones. We want to make sure there's no shrinkage of the testicles. We want our body to continue producing testosterone, because what happens when we're getting it from an outside source is that our brain is kind of like, okay, great, I don't need to produce it anymore. And then it sends a message down to the testicles to stop producing testosterone. So there is a science behind all of this. There are reasons why we have the testosterone with the supportive therapy. I have had a lot of patients that have come from other clinics who did not have the supportive therapy. And so they are generally very excited when they come to us, and we kind of just take care of all angles of everything. But ultimately, consistency is what's most important with all the medications.
So, in my opinion, being estrogen dominant is worse than testosterone deficient, because I've been there before, and it's like brutal. I know when I miss my estrogen blocker, because like I'll get emotional. Like when I watch, I said this before. I think I was watching like The Hills Have Eyes or something, and it was like someone was dying and I was crying. Like it was like. And then you get that like bloatedness and like your joint, and then if you have too much of it, your like joints hurt if you're don't have enough estrogen. So that like middle line of making sure that your estrogen levels are in good shape is like so important to this protocol. So we analyze. You could be on 0.25 milligrams once a week, or you could be all the way to 1 to 1.5 milligrams a week, depending on how your body is absorbing the testosterone, and basically everything the body doesn't absorb basically transitions into estrogen. So we have to be super super careful that we're doing blood work consistently and we're keeping a close eye on that estrogen, because if we're not, you think you felt bad before, you'll feel real bad now. So Jill, talk to us a little bit. About your bodybuilding world, some of your successes. When have you been competing? Because I know you're up there at Steve's gym. Is that where you train?
I don't train there. No, I actually train at Lifetime. It's just a little bit closer to my home, but I'm there all the time, hanging out with the guys, chatting with them. But I currently compete as an NPC bikini competitor. I've been on my fitness journey for a very long time, but I most recently competed for the first time. So that was back in April. I went down to North Carolina and I did the Charlotte Pro. I won in first in true novice, and I came in second in open. So I qualified for nationals, and I'm going to be doing nationals here in July, which is actually a Bev Francis show.
Yep.
It's here in Jersey. So it's a pretty big deal. I'm keeping my fingers crossed and working really hard to hopefully get my pro card. uh, so that's my journey.
Well, is that Steve's show?
Yes, that's Steve's show.
That's great. So, I think Mel and I might actually be up for that this year. So that'd be cool to come. I've never met Jill face to face, guys. So she's worked with me for what, like two years now, 2.5 years.
Year, yeah,
What's that?
year.
A year? Oh, sorry. See how great of a owner I am. I don't even know what's going on. But Jill, honestly, thank you so much for all your knowledge today. You did fantastic, guys. don't be shy. Though I want to close this out by letting you guys know that even though our NPs and PAs are, they're super professional, these are face-to-face visits. They're all they're all very attractive, and don't be shy with them. They've heard everything. I mean, I'm sure Jill could go on and on with stories that she's heard about crazy things that men have said to her on the phone, even females and vice versa. We hear this stuff all the time. Just before we close out, Jill, how important is it that you know everything that is going on inside the male or female that you are interviewing through the telehealth visit?
It's absolutely crucial to know everything because, like I said previously, we're not just treating your hormonal imbalance. I'm looking at your lab work. We're assessing diabetes, high cholesterol. We're assessing your entire bodily function, essentially, and cardiovascular conditions. So I do need to know everything because it all comes back down to our brain and our heart and the basic functions of our body, your kidney function, liver function. So it's not just kind of like, hey, we're going to treat your hormonal imbalance. We're treating as a whole here. We have other medication protocols that we're able to start you on in the event there was something else going on. So it's not just about hormones or weight loss or just looking good in the gym. It's we have a holistic approach. We treat as the whole here. So it's definitely very important to just know everything about the medical history, personal history, whichever, when treating everybody.
And the other side of it too, guys and girls out there, if you do happen to have a significant other, it's really important too to communicate with them with what's going on, because sometimes this is a family journey. Sometimes both people might need to be dialed in and get blood work done, and our blood work is so extensive that most males and females never get blood work this extensive done, and they don't get to see their PSA until they're 45, or a CA 125 for ovarian cancer screening ever in their life, and we can avoid quite a few things by getting these types of blood work done. And it's kind of, my wife and I both are very consistent with our blood work, very consistent with our visits with the core NPs, PAs, and MDs. So don't be shy with communication with our staff and your significant others, because the goal here is to the goal of core is to build a new future of health and wellness. And when you're doing that together with somebody else, it's a lot easier. If you have one person in the relationship that's getting in great shape and now has all this energy, and the other person that doesn't help the relationship. So just a little food for thought there. So Jill, thank you so much. You are awesome. I can't wait to meet you face to face. And thank you so much for your time today.
Thank you for having me. So great. Have a great one.
We'll, we'll talk soon. All right, guys, I'm out.